So 71% of oral pharyngeal, so that's tongue, lip, tonsil, anything in the mouth area, 71% is HPV related. Okay. So really, if you want to, the younger kids today are certainly at a way bigger advantage than we are because there's a vaccine, which we'll talk about in 1 second, to prevent it. Okay. So 71% of oral pharyngeal cancers are HPV related. So if you have a sore in your mouth that's not healing, if you have a painless, well, adenopathy means swollen lymph nodes, but if you have either a bunch of lymph nodes on both sides of your neck and they're painless, we start to think like metastatic disease, Hodgkin's disease, non-Hodgkin's disease. But if you have a single lymph node that's enlarged, you need to see somebody. Short of, yes, if you have a toothache or you have, strep throat and you have enlarged lymph nodes, those by and large, so a non-healing mouth ulcer, you need to think about it. So, getting to HPV, because a lot of people have vaccine issues now. That is one vaccine that I think is mandatory. And, we'll give you the guidelines. Remember, fortunately, 80 to 90% of HPV infections are cleared by your body, by your immune system within 1 to 2 years. So just because you might have had HPV in the past doesn't mean you have it now. But the point is, really, it's almost, I'm not going to say 100%, but it's really preventable. So the guidelines say that the shot should be given starting in 11 and 12-year-olds. That's boys and girls.
And I gave it to all 4 of my kids. And that's one that I would not skip. And like you said, I know today a lot of people are vaccine phobic, but that's one I wouldn't skip because that right there is preventable. It's going to prevent diseases.
Yeah, it's really, if you think about it, HPV related cancers, like I said, are not 100% preventable, but most cancers are not preventable. That's it. And the key is you got to get them the vaccine early, before they become sexually active.
Correct.
Okay.
That's why they say starting at 11.
Right. And yes, it's been tested against placebos. So for adults, basically, while it has been approved for everybody under 45 in the United States, it's not recommended. So once you're over 27 years old, it's really not recommended, except if you're in the healthcare field and you're having occupational exposure and you're above 27, because, it's you got to look at risk benefits. If you're over 27, you've probably engaged in
been exposed.
Yeah, exactly.
And they're still studying it in the older age population, older than 45. There's ongoing studies, right. But I would say before kids are sexually active, get them the vaccine.
Right. I mean, because we're going to talk about Pap smear in a second, but by and large, the majority of cervical cancers, HPV, anal cancer died of HPV. So, penile cancer, which is very rare, HPV, related. So big deal. Okay. So that's nasopharyngeal.
Fairly deadly oropharyngeal cancer. So
bad.
Yeah.
Bad.
Yeah. You don't want that.
And the surgery is disfiguring, horribly disfiguring.
Yeah. It's not, it's terrible.